Here right now. This is my first Facebook Live for West County Plastic Surgeons of Washington University. I'm Dr. Myckatyn, and I am here to provide information and answer questions about liposuction. Some people call it lipo or suction-assisted lipectomy, but that will be the main topic for today. So as you guys are joining us, please feel free to type in your questions or comments, and I'll go ahead and answer them for you today. As we sort of get started here, one of the main things to consider when pursuing liposuction or wanting to speak to somebody about doing liposuction is, the type of physician that you choose to go to. So I'm a plastic surgeon, so I'm board certified in plastic surgery. In the United States, the regulatory board that basically credentials and vets all plastic surgeons is called the American Board of Plastic Surgery. So that's a part of the American Board of Medicine. So what you want is a plastic surgeon that is specifically certified by the American Board of Plastic Surgery. So you should always be looking into that or asking that question when you see your provider. And it's specifically that. It's not the American Board of Cosmetic Surgery or some other board. It's the American Board of Plastic Surgery. So what I can do now is briefly go through the main steps of liposuction for y'all. So liposuction can be done in many different body parts. The most common places that we do it here in our practice would be the abdomen, the flanks, the trunk, meaning the bra strap roll area, in through the back as well. But then also thighs are very common, particularly the inner thighs, the outer thighs, the front of the thighs, sometimes also that little part just above the inner part of the knee. That's a common place also to do liposuction. Underneath the chin or underneath the neck is another very common place that we'll do liposuction as well. And so, what do we do with liposuction? So the first question is going to be, whether somebody wants to be awake or asleep when they do their liposuction. In our practice, we do it both ways. And, as you have a consultation with various physicians, you'll see some of them do it just in their office, some do it just in their operating room, or a mixture like we do. So the reason why somebody may choose to do a liposuction asleep or under general anesthesia or sedation would be because there's a little less for them to worry about, meaning they're asleep, they don't know what's going on, and they don't have to sort of be sort of privy to that whole experience. So we tend to do more of our liposuction that way. It's also a little bit safer to do liposuction when you're asleep, particularly when we're doing large volumes of liposuction. But then there are cases also where sometimes patients don't want to have general anesthesia. They're a little concerned about that option. And so instead, they go ahead and we can do that in the office. We typically do that with just smaller volumes of liposuction. I'm just getting my first question here. Oh, how do I wave? I have to figure out how to wave back. Oh, I'm waving. Hi, how are you? I thought there was a wave button. This is the first time I'm doing this, so I am waving back. Thanks for waving. So what do we do? So the first thing that happens with liposuction is we make a tiny little incision near the place that we're going to liposuction. So for example, if we're doing liposuction around the belly or the abdomen, most of the time we're making tiny little incisions sort of in the bikini area or just below the bikini line. And then through those tiny incisions, we're then injecting fluid. And the name of the fluid is called Tumescence Fluid. And basically what that is salt water. And that salt water contains one drug called epinephrine, which is your body naturally makes that, but it's also called adrenaline, and it's a chemical that constricts your blood vessels to reduce bleeding during liposuction. And then the second thing that we inject typically is lidocaine, which is a local anesthetic to reduce pain during and after liposuction as well. So that fluid is injected into the space that we're going to do liposuction in. That also allows us, if somebody wishes, to do some of the liposuction awake in the office, because we're essentially numbing up that area. And then we give that a couple minutes to work so that the chemicals have an opportunity to eliminate pain with the local anesthetic effect, and also to constrict the blood vessels. And then we go ahead and do the actual liposuction. What that means is we're putting in a small cannula or a tiny probe. It's literally the diameter of a pencil. They're anywhere from 2 to 5 millimeters in diameter usually. And then that little tiny probe goes in through that little hole, and we put in this tube. It's attached to a hose with a suction device, and essentially we're just sucking out fat. The amount of fat that we're sucking out depends a lot on several things. So first of all, we want to make sure that we're getting enough fat to improve the contour for our patient. However, we don't want to overdo it, because if you overdo it, there's a couple things that can happen. One is it can cause injury to the skin and cause puckers in your skin. Another thing that can happen is if we oversuck and the skin doesn't tighten up over the fat that's removed, you end up with loose skin. So it's important that the skin contracts or retracts over the fat that we removed. Ways that we can sort of tell if we've done enough: we'll pinch the skin to make sure that it's a particular thickness. Of course, we'll look to make sure that we've made the correction. Often we're comparing the left side to the right side, for example, to make sure that they're even. And then we're also making sure that there's not a lot of blood loss as well, because if it starts to get a little bloody, that's another trigger for us to stop doing liposuction, meaning we're starting to take out stuff that's not fat. And then once that's done, we then go ahead and we push out any fluid that was still put into that area. We often will put little tiny stitches in to seal up those little incisions. And then we put compression on that area. And that's really important because that's reducing swelling. It's also allowing us to essentially mold the skin over top of your muscles, so that to kind of help that skin sort of shrink wrap or conform to your frame to get a better contour. So that's also very important. So I'm just going to check now to see if we have any questions so far. Just going to quickly ask Lisa if we have any questions. Lisa, do we have any questions? How can I tell?
They'll be right there.
Oh, they'll be right here. What is the downtime with liposuction? So that definitely varies. So when people have small areas of liposuction that is performed, there are, in all sincerity, some people that can get back to some forms of gentle working out and some pretty vigorous day-to-day activities just within a couple days. But it really depends a lot on the amount that we're liposuctioning, where we're taking it from, and just somebody's honestly their pain threshold a little bit. So for example, if we're doing sort of in men, the chest area, for example, a lot of those guys are getting back to working out and things probably within a week or less. But there are definitely cases where, we'll do some liposuction. Some people don't bruise a lot. Some people do bruise quite a bit with liposuction, or maybe they bruise on one side but not the other. And that can be a little tender and uncomfortable. And that can be, 2 or 3 weeks before they can resume sort of more vigorous activity. But for things like just getting up and walking around, going to the supermarket, going out for dinner, looking after kids, picking up a baby, those types of things, people should be able to do those within a day or two of liposuction in most cases. But there is some variation. Okay. So how long do the results last? So in terms of the duration of the results, so it does depend a little bit on the patient, meaning with liposuction, like most forms of plastic surgery, we're sort of turning back a clock, but we're not stopping it. So liposuction is never a replacement for diet and exercise. So if you make the assumption that somebody continues to exercise and they adhere to a good, healthy diet, the results for liposuction should last for many years. As you get older, things happen though. So for example, if somebody has lipo of their abdomen, for example, that fat is removed and it's, taken out, put in a trash bag, and it's gone. However, over time, things happen. Muscle tone gets less, particularly if people are not working out or pregnancy or just age. And so you can get some just sort of reduction in tone and a change in the contour of your belly just from that. And then the skin itself can lose some of its elasticity over time. So it becomes looser. And that's going to happen, whether you have liposuction or not. So the result of liposuction, assuming good diet and exercise, will last for many years. But you also have to consider what's happening in the background as we get older as well. So one question was, if you're having a baby, how long should you wait for this type of procedure afterwards? So depends on the part of your body that we're going to liposuction. So often people who have children, one area that's a target after pregnancy is the belly. And so I think the first step there is have your baby, enjoy your baby, complete breastfeeding, and then come see a board certified plastic surgeon. We would then at that point decide if liposuction is actually the best procedure or if you may be a better candidate for some other procedures. With pregnancy, the stomach or rectus muscles can become separated over time. And then also the skin can stretch over time. Liposuction doesn't bring the muscles back together. Liposuction doesn't remove that extra skin or the wrinkly skin. So if those are issues that occur after pregnancy, you may actually be a better candidate for something called a tummy tuck. But if your goal isn't the belly and it's maybe the sides or the bra roll or the arms or neck, or if it turns out after pregnancy your muscles didn't get as separated as in some people and your skin tone is still pretty good, you could consider doing liposuction. I would say in the abdomen, I'd probably still wait at least a year after a pregnancy. Other parts of your body, you could probably get away with doing that sooner, 3 to 6 months later, perhaps. All right. So one other question that's come up here is the difference between Coolsculpting and doing liposuction. So they're pretty different. So Coolsculpting is a brand name for a process called cryolipolysis. And what that means is when somebody has Coolsculpting, your fat cells are more sensitive to cold than any of the other cells on your body. And so essentially, if you were to expose your muscle tissue, your skin, your fat, your nerves, etc., to really cold temperatures, your fat cells will suffer first. So you can knock out the fat cells and make sure that your muscle and your skin and your nerves, etc., are still fine. So that's the premise of it. So what happens is you'd come in to an office like ours where we have a couple Coolsculpting machines, and the area and the most common ones that we do are like the belly, the flanks, thighs, and arms, and we have one also for the neck. That area would be treated typically for about 35 minutes. So it would be kept very cold for about 35 minutes, uncomfortably cold at first, but then you get used to it. And then what happens is over the course of about 2 or 3 months, a percentage of those fat cells actually die. So they sort of have this insult of the cold temperature, and then they die. And then your body's mechanisms excrete those fat cells. And you're getting, 10, 15, 20% of the fat in the treated area can be removed with each session of Coolsculpting. But it takes a couple months to see that result. The nice thing about Coolsculpting is for folks who are like, there is no way I'm doing this liposuction business right now. Perhaps they don't want a needle, they don't want any downtime. Coolsculpting can be a good option for those folks. There are no needles, you're wide awake. You can literally read your iPad while you're having it done. You can come in on your lunch break. And essentially, those areas are being treated. I've personally had Coolsculpting. I could run and work out 2 hours later. And so, but it is a little uncomfortable, I would say, for about a week later, but it doesn't block any activities. And so that's Coolsculpting. Liposuction is a surgical procedure. The incisions are tiny, but we're making a cut, we're putting in anesthetic, and we are putting these probes inside your body to suck out the fat. So liposuction definitely has not a lot of downtime, but it definitely has more downtime than Coolsculpting. It definitely is associated with more swelling and more bruising. But liposuction is more effective. It's a one-time deal. The results are immediate. Yes, there is swelling that can, persist for even a couple months after surgery, but you're going to notice the improvement from liposuction immediately. Whereas with Coolsculpting, it's going to take a couple months to appreciate it. And the amount of improvement with liposuction will be a lot more. But it's sort of like a short-term, bigger commitment with a sort of a bigger benefit when you have liposuction. In terms of cost, which is, obviously a practical consideration, the reality is 1 or 2 rounds of Coolsculpting may be cheaper than liposuction, but to get a similar result between Coolsculpting and liposuction, Coolsculpting may end up being the same cost or more expensive because you have to do it several times. Not only that, but you're also having to do it over a period of time to get the same result as a one-shot deal with liposuction. But it's different strokes for different folks. And so, it's good to be able to have different options available depending on people's priorities and their schedules and that sort of stuff, which is why we do both. And we believe in both technologies. All right, well, let's see what else here. I'm going to go through my own personal list of questions here to see what we can come up with. So one is, who's a good candidate for liposuction? So the big thing with liposuction is picking people that are actually going to benefit from it. The goal of liposuction is to spot reduce certain pockets of fat. So flanks, belly, bra roll area, areas where there's not a lot of extra or stretchy skin. The skin tone's pretty good. If we can just get rid of a percentage of that fat, the skin will shrink down around that. So if somebody doesn't have a lot of stretch marks in that area, not a lot of loose skin, they have some stubborn fat that they really want to make go away, and they've dieted and exercised and it just isn't happening, those people are really good candidates for liposuction. Liposuction is not a weight loss procedure. Again, if somebody has extra skin, they want to tighten up some muscles, that is also not liposuction. Sometimes you can do liposuction with other procedures to get a good result, but don't expect liposuction to do much skin tightening for you. Now, one other thing that sometimes comes up is there's different flavors of liposuction. So people can sometimes talk about laser liposuction or slim lipo or laser lipo, or there's many different forms of radio frequency liposuction or ultrasound assisted liposuction or water jet liposuction. So at the end of the day, they're all still liposuction. So as I said at the beginning of this Facebook Live, we're numbing the tissues and we're sucking out fat. But between those two steps, we will often add some type of an energy to help melt the fat cells, reduce bleeding, or tighten skin. So for example, if you have some type of laser liposuction, we still numb up the tissues through a small incision, but before we suck out the fat, we put in a probe that has a little laser on the end of it, and there's different brands of that. But these lasers, what they do is they heat either the blood vessels or the collagen, which is the protein in the skin, to cause some tightening. And the thought is that perhaps it can reduce some of the swelling or it can tighten the skin a little bit. Ultrasound assisted liposuction, such as a machine called a Vaser, uses high frequency sound energy to break down the fat cells before they're sucked out. And that can be really effective if the fat cells are amongst a lot of fibrous tissue. So we use it a lot in male breasts, for example, which have a lot of fibrous tissue to treat something called gynecomastia. And then the water jet liposuction uses a high pressure stream of water to help dislodge the fat cells before you remove them. So they're all different ways to try to either reduce swelling or pain or tighten skin, but you're still getting the liposuction part. A question has come up here. If a tummy tuck is the route that's needed, but can some liposuction be done as well at the same time? Also, is it true that some people do tummy tucks right after a C-section? So the first part of that is, so definitely it may be that a tummy tuck is the appropriate procedure, but there's other parts that you would like liposuction on. Can we do that all at the same time? And is that a popular situation, or does that come up? Yeah, absolutely. So meaning, you may see a plastic surgeon, they may examine you and say, yeah, for sure, I think a tummy tuck is going to be appropriate. We want to remove some extra skin. We want to tighten your muscles, but maybe on your sides or along the back or on the thighs, there's other areas also that would be good candidates for liposuction. For sure, we can definitely also do liposuction on those other areas. So that definitely comes up, and that's appropriate, and I agree. Do some people get C-sections or tummy tucks right after C-sections? I do know that sometimes people have C-sections, and sometimes, because we've seen these people come through the office and maybe their gynecologist has removed some of the extra skin for them at the same time. That is not a practice that we tend to do here in our office. I would have some reservations about that. I'll tell you what those are. So one, when somebody's pregnant, they've delivered their baby, the muscles in the abdominal wall have just relaxed. And your body is secreting a whole bunch of hormones called relaxin and various hormones, which cause a contraction or relaxation of muscles. So I don't think that's a great time to be reapproximating the muscles in a tummy tuck. And then also, some of that skin does shrink down a little bit after pregnancy. And you would want to give it a bit of time, I think, after delivering the baby to see how much of it actually needs to come out. Not to mention, as you've probably seen on many plastic surgery shows, we like to stand people up, sit them down, draw on them, mark them, have them potentially wear a piece, like a bathing suit or some underwear, so we can do our best to try to conceal a scar. We can't sit somebody up and move them around and stuff right after having a C-section. So it would also be, I think, difficult to do good, accurate marking. So that has not been a practice in our office. We sometimes help the gynecologist with complex closures and things like that after C-sections, but not routinely doing tummy tucks. Do we do labiaplasties in the office? Yeah, absolutely. That's actually one of the more common office procedures that we do. It can be done under local anesthesia, and labiaplasty typically takes, honestly, 30 to 40 minutes to perform, but that is a very common procedure done in the office. And yeah, absolutely can be done under local anesthetic in the office. All right, so, well, thank you so much, everybody, for tuning in to today's Facebook Live. I hope to do these on a weekly basis. Myself and Dr. Tenenbaum will alternate back and forth, and we'll try to pick topics that are broad topics in plastic surgery, but please also feel free to contact our office. So if you feel that there's some sort of topic matter that you want to hear about and get some board certified plastic surgeon opinions on it, we definitely want to do this. We're doing it for you guys. So we want to make sure that we're providing content that's educational and, get you some good, solid information. So thanks very much. And I'm going to check out now. Enjoy your day. Thanks.